Alright, so we want to stay within the scope of our role. So what are the type of questions that you should be asking?
In this section, we're going to take a look at questions related to patient access. So I've broken this material into 5 sections. The first section dealing with patient demographic. The second section dealing with obtaining health insurance information, followed by documentation of medical information. Fourth section deals with capturing special needs and language preferences. And the last section is financial obligations. Again, these are just my 5 that I've broken the material down into. So let's start off with the first section, entering the patient's demographic information. To me, this is the most important part to get right outside of the insurance payers. So that patient demographic information, never assume how the patient's name is spelled. Always ask, always look for some sort of reference, driver's license, some any information that you can definitely look at and get it right the first time, along with that date of birth, the patient's address, the phone numbers, their race, their ethnicity. Don't assume that. Ask and engage your patient and their family to get those pieces of data correct. Their gender. How do they want to be identified? The patient's emergency contact information. Their email address, whether they're an organ donor or not. And their employer information. Again, never assume the answers to any of these things. Always validate the information that you're about to put in or the information that's already on the screen. The next section has to deal with obtaining health insurance information. So that's obtaining that policy number, group number, the subscriber's information. If you can get your hands on the front and the back side of that insurance card and scanning that into your EMR or recording it or uploading it in some way, that is always a great help to our business office. You want to obtain workers' compensation information or claim number information dealing with a motor vehicle accident or an injury at the job. And of course, the contact information so that we can appropriately follow up with those adjusters. Next section is documentation of medical information. So better known as the script or the referral. And on that script or document, you should have the reason for the visit, following up with ICD-10 codes and CPT codes, the primary care physician, or better known as the PCP or the referring provider, or even the specialist, and the contact information, which includes their NPI number, their National Provider Index number should also be on that documentation as well. If not, you'll have to reach out and obtain that. And you might even be asking for the patient's last visit so that you can record that into your EHR system. The next section has to deal with capturing a patient's special needs and language preferences. We want to find out if that patient is hearing impaired, visually impaired, so we can make special accommodations. If they have limited English proficiency or LEAP, so basically English isn't their primary language, English is their secondary language, so that we can overcome language barriers by perhaps reaching out for an interpreter. And we definitely want to obtain the patient's preferred language for their medical information. Just because someone speaks a primary language of English doesn't mean that they want to have their medical information printed out or even provided to them verbally in the language of English. Always ask, always find out, always try to make those accommodations happen. And so we do have financial obligations. That's my last category. It's for co-payments, deductibles, obtaining out-of-pockets, co-insurance, and financial assistance. Some organizations are fortunate that they do have medical assistance advocates, or also known as financial counselors, which are able to help our patients who do not have insurance qualify for insurance or perhaps even charity care. All right, so those were my 5 sections on questions related to your role as a patient access rep. Hopefully you found that to be very comprehensive. And if you are a patient access rep already, you're probably quite familiar with a lot of the categories and the data elements that were presented in the slides. And if you're not a patient access rep yet, you will become very familiar with the information that were on those slides. Again, that is just a simple overview, and your facility may ask you to do more or less in regards to the 5 categories and the different questions that you need to ask your patients.